Hello everyone. Welcome to Brainlessmedico. This is your Dr. Manoj. In this session, we will explore key concepts you need to master for your MBBS journey. So, let's dig into it. Let's start with the compartment syndrome. So, definition goes like this: increased pressure leading to symptom complex. So, next we'll look into the etiology part. We have mainly two etiology which may be due to increased contents or it may be reduced size volume. So let's see detail in what happens in the contents. We have mainly bony fractures, then muscle related, then vessel related. Okay, what are these? Bony related, muscle related, then vessel related. In bony fractures, we'll see most common fracture like we'll split into children and adults. Okay, we'll go with the children and adults. So in children's, which will be the most common bony fracture you are going to see is supracondylar fracture, right? Supracondylar fracture. Then in adults, we are going to see proximal tibial fracture. Okay, then coming to muscle part, we'll have crush syndrome. Then we have traumatic rhabdomyolysis. So coming to vessel part, we have only one thing can happen, that is vascular injury, right? Okay, coming to a reduced size volume, it may be due to tight circumferential POP or dressings casts. Okay, there may be a problem with the one who treated the person, which is usually, this will be usually not done by the actual practitioner. It is usually done by the quacks of that famous orthopedician without the degree of orthopedic, right? Then coming to what are the clinical features, you need to remember there are 7 P's, right? 7 P's. If you remember these 7 P's, then you'll be in the P's, right? So let's see. 7P. In first P will be pain, then pain on the passive stretch. See, usually that hand will be contracted. Then when the doctor try to stretch it straight, passive stretch, then the patient will scream. So it is called pain on passive stretch. Then pressure increase, we'll see paresthesia, then pallor, the color on that site. Then we will see pulselessness, which is that we least useful for us, like it may be subjective. Then at last we'll see paralysis. So what are the 7 P's we saw? Pain on passive stretch, pressure increase, paresthesia, pallor, pulselessness, paralysis. So we saw 7 P's which made us to not rest in peace, it's a peace, right? Then coming to management, you are seeing a big letter, emergency fasciotomy, which means nothing, just cut the skin superficial fascia, then deep fascia, so that the pressure will come out, so that it will be normalized. So, and there is one question, what is the diagnostic pressure? Any guesses? Normal will be 6 to 12. Okay, so diagnostic, if you want to say it is a compartment syndrome, it should be more than 30 mm, right? Sorry, not 730. It's a 30, right? Okay, sorry, my mistake, right? So let's revise it quickly. So today in this video, we learned about compartment syndrome, which means increased pressure, symptom complex. Then etiology we saw, there will be increase in the content or it may be due to reduced size volume, which means take a pipe, you are applying a compression over outside of that pipe, so that it will compress, and inside there is a full of water which is giving inside pressure. So pressure will be increasing inside, but outside there is a limited space, so it can't even expand, right? That's what it means. Okay, so it is due to tight or circumferential POP, dressings or casts. Then coming to contents, we have bony related, then muscle related, then vessel related. So in bony fractures, we saw supracondylar fracture, proximal tibia fracture. Then in muscle, we saw crush syndrome, then traumatic rhabdomyolysis. Then in vessels, we saw vascular injury. Then we saw 7 P's, which made us to be in peace. Then we saw management, which is emergency fasciotomy. That's it for today's lecture. Keep learning, keep growing, and I'll see you in the next one. This is Brainless Medico, making medicine simple.